Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be doing a preview of the 2024 RSNA conference in Chicago. And thanks to Sway.Health for sponsoring this episode. Be sure to join us at the Sway.Health Live Marketing Conference, April 15th to 17th in sunny San Diego, Coronado Island. It's going to be amazing. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 18 years of health IT content at healthcareittoday.com. I guess it's good that we're talking about RSNA because that's like almost the end of conference season. ONC's kind of put theirs out there in December too, but December doesn't have as many conferences. Like RSNA is kind of like that cap.
It is. It's the last of the large conferences, right? Like there are a few others that are right at the end. I think the IHI conference is towards the end, and there's a couple others, but yeah, usually when you reach RSNA, you've reached the end of the year.
Yeah, I think, it's interesting. You're going to be going to RSNA. I think AWS's event is in Vegas. So I'm hitting that one up while you're at RSNA. So, yeah, there's a little overlapping, although I don't think community wise it's that overlapping. But yeah, and then, I may go to ONC and then I'm done for the year, which it's been, does it feel like there's more conferences, Colin? It feels like there's more to me.
I think the reality is we're going to more. I don't think there are that many more conferences in
Really?
the year, but I think we've attended a lot more than we ever have. So I'm
Yeah.
definitely looking forward to getting to RSNA. And yeah, it's already unbelievable that we're already talking about it. So
Yeah,
uh,
for
it'll be
sure.
fun. It's
Well,
gonna be
and you
fun.
went last year, Colin. So, kick us off. What are going to be the hottest topics of discussion at RSNA 2024? And, maybe some things that aren't going to be talked about.
Well, I'll give you the easy one. I think again this year it'll be AI that's going to be the hottest topic in radiology. And you know, last year there was a lot of talk about how AI can really help with workflow and maybe help prioritize certain images that are, in the queue rather than being first in, first out kind of deal, like, using AI to kind of prioritize things. So I think that'll continue to be there, but there was a little bit of an undercurrent of, well, could we get to some automated reading of those very simplistic and straightforward scans? So I expect that will be something that will be more talked about this year than in last year's.
See, Colin, I actually am just going to disagree with you on this. I actually don't think AI is going to be a huge, huge topic. I mean, sure, it'll be there, right? There will be some, but I actually think a lot of radiologists have been kind of alienated by the AI that's available for radiologists. And there was a really interesting study that came out that kind of talked about it from especially on a diagnosing perspective and kind of a read perspective. They don't really diagnose; they read the image. But when they read the image, when you look at what's being done, and the more radiologists I talk to, the more they say AI doesn't think the way a radiologist thinks because AI is very linear right now. And so, in order to do a proper read, you need to take in multiple factors and multiple assets to be able to do, a better read. And so, they're arguing, and I think that's been their experience with AI, especially on the read side of things, that it hasn't lived up to billing. And so, I think a lot of radiologists are alienated by it, and so I actually think that they're probably not going to be as interested in that this year as as probably they should be. And I think there's some concern there, that when I look at it, we have my radiologist friend literally today, just before we were started recording, messaged me an article that talked about the shortage of radiologists. And obviously the article talked about that's a real potential opportunity for radiologists to go and make more money. And that might be a topic that will be discussed, is the shortage of radiologists. I'll throw that one out there for RSNA that, I think will be discussed. But, what was interesting as I discussed the kind of trends that are happening and the dependence of the hospitals, health systems, practices on the radiology read to be able to provide the care. Like that dependency has become stronger over the years, where they literally won't provide care until the results back or it's been read. That's created this demand for radiologists, and there's not enough supply. And of course, I responded to him and said, well, that's what's going to push AI. It's all these people that are like, I need a read and you can't get me one, so I need something. And even if the AI isn't perfect, isn't the way I want it, it's better than waiting, a day for a read, 2 days for a read, or even hours. So yeah, I think that there is some interesting discussions there as far as capacity as well.
Yeah, you're not wrong. I mean, I do think that we're still very far away from AI diagnosing, sorry, or reading images. But I think there will be a lot of companies that will talk about it. And I think they'll be a little bit more bold talking about it. I do realize that, yes, I don't think the industry itself is ready for it. But I think I mean, I do disagree with you. I do think AI is going to continue to be a hot topic because of all the ancillary things that it can do and help the radiology, right? We started to see last year AI determining whether or not a read is even necessary or imaging is really necessary because there's a lot of excess of that, right? And I know that goes against the whole revenue generation thing, but at the same time, we do have an access problem. There aren't enough radiologists. So one way to control it is, well, do we need all these scans? Do we need all these tests? And so AI can help with that. I saw some companies making that kind of technology. And I do think also in terms of being more pinpointed into where the scan has to be done, whether, and what type and so forth. I think, again, AI, these are very interesting things that can happen and I think will be discussed at RSNA. I do agree with you. I think one of the areas that I would say is definitely going to be more discussed is this um, confluence of radiology and imaging with surgery, right?
Hmm.
Like there was a lot of talk recently that I've seen around like, hey, like now to use those robotic surgeries, well, why not have something to be able to see while I'm there, right? And
Hmm.
so now you're talking about X-ray and other types of technologies to be able to see and give guidance to those robots that are doing the surgery, which before wasn't even content, like it was a sort of a rarity to do this. But I'm looking forward to seeing at RSNA a lot more of that coming together, like the surgical world and the imaging world and all the related technologies and IT that's going to be required to support that.
Yeah, and we see all this computer vision that's happening with a camera, and in many ways, the MRI, the CT, those are kind of like the visual camera of the internal of the body, and so you can see why that makes a lot of sense. I do think there are going to be some AI, nuances that are going to be interesting there, and that actually it's very similar to what we're seeing on the health IT provider, doctor side of things where the ambient clinical voice is reducing the burden. Well, I think we're going to see the same on the documentation burden that the radiologist has. I did a recent podcast with I think he's director of AI, in charge of the radiology side at Jefferson Hospital, and he was talking about using the AI to take all of the findings and to actually generate the note for them. And I think that's really interesting because that is the minutia of the job, right? I mean, it's one thing to read it, it's another thing to actually document it. And we all know that the brain works faster than, our typing can do. So I think some solutions like that will be interesting. The other one I'm really interested to see is actually the evolution of the research around using the technology. And often it's just data and machine learning versus AI. And I think we're going to see some real progress there. I just saw IBEX issued a report, which I haven't had a chance to read fully, but it's looking at breast reads and how effective they are at it, and how effective. And in fact, the initial finding wasn't so much it was reading it itself, it was comparing a radiologist doing the reads against a radiologist with AI doing it, right? And obviously the initial read that I saw was that they obviously saw some improvement because it helped them to be more efficient and and better at what they were doing. So anyway, there's a lot more to dive into that because it's a fully published article that's taken years to put together and do that, and I'm reaching out to some radiologist friends, but I think there's going to be like a lot more discussion of that because the data and the technology is there and has been for enough years that now we're getting those papers that are really proving out the quality and the efficacy of the technology assisting the radiologist.
Yeah, there's a couple of things that I'm going to mention as well that I think are going to be maybe not hot topics, but certainly topics that I'm interested in exploring while at RSNA. One is, this whole movement towards improving patient experiences. We know that, competition is hot, right? For clinics, for imaging clinics and so forth. So they've put a lot of focus recently on improving the patient's experience with those clinics, with their organizations. So I don't know how this is going to manifest. Like, I don't know. Like, are they investing in like CRM systems? Are they doing other things? So I'm curious to see how that's going to manifest this year at RSNA. Because last year there was a lot of focus on, well, I'm going to really improve the way that patients can retrieve their images and make it easy for them to go get it and read the report and then get it into the hands of their primary care physician or their care team at the hospital. But I've been continuing to hear that a lot of them really now are moving towards things like online booking and constant communication with patients so they know exactly what to expect when they arrive. And you know, again, very cool stuff. I'm wondering how much of that technology we'll see at RSNA. Uh, and then of course things like around VR. I mean, again, this technology you think would be pretty amazing for this space. And although it hit the sort of height of hype a few years ago, last year I started to see a bit more practical applications of it. And so I'm kind of curious to see, whether or not the research that these larger companies have made in this area are now going to start to manifest at this year's RSNA. So those are two things I'm going to keep my eye open for.
Yeah, I mean, we'll see if VR plays out. It's funny, we're on a different page. Like, I actually think the thing that won't be discussed at RSNA enough is patience. Like, I'll be shocked if you see any patients there, which is, in some degree you understand. It's like a security conference, right? Does a patient need to be there talking about how to configure your access list or your firewall? Like not really, right? And would they even understand some of the studies that are presented at RSNA? Probably not, right? You need the radiologist to be able to understand it. But it's a little sad to think, because to your point, it does impact the patient a lot. So it's sad to think that there won't be a lot of patients there sharing their voice and asking their questions. E-patient Dave's the epitome of this. I saw him at an HL7 interoperability meeting, and I was like, wow, this is pretty interesting that they're including a patient and have his voice. And when you heard his questions, they were very different than everyone else in the room. And so yeah, I wish there was a bit more diversity in patients, but you'll have to tell me how many patients you actually see at the event.
I will put a mark on my badge for everyone that I run into. How about
I
that?
love it.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are previewing the RSNA 2024 conference in Chicago. This episode is brought to you by our sister publication, Sway Health, and we're happy that we officially made the announcement that Sway Health Live 2025 is happening April 15th to 17th in sunny San Diego. Head on over to Sway Health, that's Sway with two A's, .health to find out more information.
Yeah, we made the announcement and the response has already been like, oh, this place, yes.
I
This
mean,
is going to be a great location.
it is hard to fault anywhere in San Diego or Coronado. It's so beautiful there. So
Yeah,
yes,
it'll be our biggest yet. I already predict it.
I love it. I love it. So John, I know you're not going to be there, but are there any companies or technologies that you're looking forward to me covering maybe or me checking out while you're at RSNA?
Yeah, and I want to hear what they say. Like I love what when I go, and I love hearing what they're announcing. The big companies in the space, the GEs, the Philips, the ones that are selling the MRI machines. And obviously, we're not covering the machines themselves. Obviously they're releasing a bunch of devices that are getting smaller for different uses as well, whether it's like the ultrasound. I saw one of those recently. It's like, man, it's gotten so small, it's incredible, you could use it almost anywhere, right? Like, but I love how they're integrating it with the EHR data. That's been really fascinating for me. So how are they integrating it with the EHR data, with other AI vendors, with other, and how are they kind of making it into a platform where you can solve a lot of problems with all of the data there? Because I've heard it from a lot of radiologists how having the data available about the patient and why the doctor even ordered the ultrasound or the MRI, like that helps them in their process either be more efficient, more accurate, etc. So it's kind of like when I wash the dishes. If I've washed the dishes of stuff that I ate, I know what was on there and I know how to clean it, right? Like, but when I'm washing the dishes from my kids and I don't know what they ate, or my wife, like it's to me it feels like the same thing. So I love solutions like that, right? That give you the extra data so you know what to look for, you know how to do it, and it make you more efficient and effective. I think the other one, of course, for me, is our friends at Pocket Health, which are bringing a patient focused to discussion there. And I love that they're doing that and that they're empowering patients, with their solution to be able to get access to the information about the radiology images and read. So yeah, I think that's another one that I love as well.
Yeah, I mean, there's tons of technology. I love the two that you just mentioned there. I'm always interested to see what the GEs, the Philips, even the Samsungs, the Canons of the world, right, are doing, and they always have some amazing equipment. And funny enough, their equipment is getting smaller, right, like and bigger, right? They're getting smaller and bigger. The small stuff is really interesting because that's lending itself more to a whole new area of what happens when you're able to do imaging at home now, right?
Yeah.
Like in the home. Like that is something that I really can't wrap my head around. And so I'm really curious to see, if that's going to be a thing or a thing. And certainly there were a lot of more companies last year that I noticed were doing portable units. So these were mounted on the back of trucks or in portable sort of shipping container type units. In order to hit some remote communities or be able to bring those to remote communities. So I think I'm going to see more of that this year, especially again as access continues to be a big challenge, and now payers are really jumping on board to go, hey, like this is needed, right? Like, and perhaps willing to fund some of that. But then I think on a smaller scale, there are some companies and some technologies that I'm interested in. Of course, interoperability with imaging is still a challenge. And, last year I did an interview with our friends over at Data First, right? The guys with the
Mhm.
racing car. I'm looking forward to kind of checking out what they've done and how they've continued to grow. I'm interested to reconnect with our friends over at Redrick. And by the way, you got to check out my review of their at-home workstation. I'm interested to see what new technologies they bring to RSNA and in terms of having really good ergonomic workstations. And then, yeah, it's just some other things around, making the reads that the reports that come out of radiology to be much more user friendly. So, I've done some interviews in the past with Scanslated and other companies like that that sort of take that and turn that from the radiology jargon into something simplified. So, those are some of the companies and technologies that I'm interested in and will be stopping by to check out.
Yeah, the other one that's interesting for me is the evolution of vendor neutral archives. They're kind of ubiquitous in some ways, right? But there's always this interesting battle, and especially, like should it be in the cloud? Should it not? I wonder how Amazon and Google Cloud and Microsoft Azure, how they're going to play, at this year's RSNA, along with the others, companies in Telerad and your buddies over there at Ramsoft, right? And Highland does a lot of work in this area too, right? I mean, there's a whole bunch of others that are working in this space. Yeah, those are going to be interesting to see how they continue to evolve. Are they going to the cloud? Are they not? And how are people doing that? And how are they working across product lines? Are they working with Canon and GE? And or are they not? I think most of them are, but some of the standards evolution is interesting. The other one that's fun for me, and like I said, this isn't our area necessarily, but I always find it fascinating. I think you do too, which is like all the ways the software from either the vendor neutral archive vendor or from the readers themselves, which they usually have some sort of solution. Also, like they're able to highlight stuff or slice and dice it or focus on, I mean, just the way they make it usable for the radiologists, that it's such a lesson in usability that's so fascinating. That and obviously it's very colorful, it's very visual, so that there's that as well, which makes it fun. But those are always interesting aspects for me too.
Yeah, the visualizations are insane right there. Like, you walk around and you see all these colorful things, and sometimes I have to go up and ask people, is that the dye, or is that like you're visualizing it? And the answer is usually both, right?
Mhm.
But it is incredible. I mean, it looks like NASA, right? Some of these just visualizations. But you're so right. Like they're so tuned. Even like I said, even the workstations, even the way they lay things out on the screen, so optimized for radiology. That is something that, I think a lot of a lot of people who are not radiologists would love to see from other vendors, right? That level of attention to the needs of the end users. So, yeah, you're right. I'm looking forward to seeing some of those things.
Are you gonna hop in and get a little scan? Like, I mean, it's interesting, like radiologists aren't excited about that because they do it all day, they can do it whenever they want. But it is interesting the evolution, right? I mean, nearly like whole TV screens in there that you can watch a movie while you're in there, or they have the star ones, or like the evolution of usability for the patient that has to be in there for often it's an hour at a time, 2 hours at a time for MRIs. So, it can be a long, long time laying there. Some of those evolutions are fascinating to see as well.
I mean, I have to say this, RSNA is the only conference that I go to where there are live models like in the devices, right? Like
Yeah,
it's the
it should
only
be.
right? Like, and it's probably the most appropriate use of the, and they're just regular people. Like they're not models in the sense of super magazine models. They're just people, and they're just playing the part of the patient. And I have to feel for them, right? Because they're dressed in a gown. And they're lying down on this table, but they're being shuttled in and out of these machines. And I know they're not real machines there to be shown, but it is the one place, and it's always funny to see how they use that to attract people and frankly to demonstrate the usefulness and the usability of their products. So that's always a lot of fun.
Yeah, it'll be interesting to see who has the biggest one, right? Are they still the football field size booths that have all the big machines? I mean, the load in on that is just incredible. Yeah, it's going to be fun to see. So, as we wrap up, Chicago, it's one of your favorite places, I think. You've been there a lot. Maybe you've been there too much, so maybe it's not your favorite anymore. But what do you say, Colin, are your must-do, list in Chicago? Food, obviously. Any other things that you like to do or see when you're there?
Yeah, well, yeah, I do love Chicago. No matter how many times I go, there's always something I discover there, or it's just things I look forward to. I look forward to bringing home a frozen Giordano's pizza, right, so that I
Oh,
can
you
have it
bring the
during.
frozen one home?
I'd bring the frozen ones home because
Wow.
usually I drive, or even if I'm
Oh,
flying, I'll
yeah,
get
that
one and bring
works.
it through the airport. And then of course Garrett's, right? You got to get some Garrett's while you're there. So those are two food items that are just must. And then my family loves them too. So they're like, "You're going to Chicago? Make sure you get the Garrett's and make sure you get a deep dish pizza." But and I got to give my hat tip to my friend Dan Dunlop. So he's gotten me onto every time I go there, I got to try a new a pizza place I haven't been to before. So,
Oh, okay.
and it's not always the deep dish. It can be something else. So I'm looking forward to that. And
You
yeah,
can't
just,
have New York style pizza in Chicago, though. Come on,
no, that's true. It's
that's
usually deep
not.
dish.
I mean, I prefer it. I'm more New York style than Chicago. I like both, but but not in Chicago. I'm not going to do that.
But also just checking out just Michigan Avenue is really nicely lit at this time of year. And they got the Starbucks roastery there, which is always kind of got really cool gift ideas for people that you hard to buy for. So, those are kind of fun things to check out while you're in Chicago. And this is going to sound truly odd, but I love Millennial Park. Like I love going to that park. It's right up there with Central Park for me, but just walking around that, I always find it relaxing, seeing the bean or the cloud. That's always fun. So I usually
is,
make a pilgrimage over there every time I'm in the city.
is the bean under construction still, or is it done? I'm
I'm not sure, actually.
yeah.
Yeah, the last time I was there, it was kind of boarded up. You couldn't see it very well, but but I wonder if
Yeah.
it's done by now. So I'm looking forward to that.
That's interesting. No, I love going hanging out. You're right. It's really comforting. I mean, it's not Central Park. Like the Central Park's so massive, but
Sure.
the place I love to go is the river. I like to go
Yeah.
walk down by the river and just, there's always something to see, a boat going by, people watching's great. So I love hanging out by the river.
Yeah. No, it's always going to be fun. And I'm looking forward to being at RSNA once again.
And maybe warmer this year. This is a warm year,
Maybe, it has been a warmer time. So I'm
or it
hoping
could just be
it'll be
too cold.
warmer. Yeah,
The
exactly.
warm and then the cold. That's
Yeah. Toronto and Chicago have the same weather. So whatever it is here,
Yeah.
usually it's the same there. So
Yeah,
fingers
you're
crossed.
in trouble either way. That's fine.
Well, thanks to all of you who tuned in to this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.